we need to talk about something that's happening right now in classrooms all across the country. It's this collision between the growing youth mental health crisis and our school system. This affects pretty much everyone, so let's just dive right in. So, just to get a sense of the scale here, let's start with this number. A recent KFF report found that about 1 in 5 teens is dealing with symptoms of anxiety or depression. Think about that. In an average classroom, that's 4, maybe 5 students struggling. And that, of course, leads us to the biggest question of all. Are our schools, the places our kids spend most of their waking hours, actually equipped to handle this? Are they ready to help? To even begin to answer that, we have to look at the data. We're going to start with why schools are feeling so much pressure and what these systemic challenges really look like. You see, schools have pretty much become the default front line for mental health care. For nearly 1/5 of all students, school is the one place they get any kind of help. But as you can imagine, relying on them this heavily is putting a massive strain on the whole system. And that strain is just getting worse. I mean, look at this. According to that KFF report, school staff saw a 61% jump in concerns about student mental health in just 1 year. This isn't some slow-moving trend. It's an explosion of need that teachers are seeing with their own eyes. So even though they're on the front lines, about 1/3 of our schools are openly admitting that they just can't provide the services that all of their students need. There's this huge, growing gap between what students require and what schools can actually deliver. And here's why that gap exists. More than half of schools are all pointing to the same core problems. Number 1, not enough funding. Number 2, not enough staff to handle the workload. And number 3, a lack of access to licensed professionals. It's a resource crisis, plain and simple. Okay, so that's the tough reality, but it's not the whole story. Because when a system is struggling, that's often when new ideas and incredible organizations step up to fill the void. So now let's look at a response that offers a very different and much more hopeful picture. This is the idea at the heart of an organization called Erika's Lighthouse. It was actually born out of a profound personal tragedy, the loss of a daughter, Erika, to depression, and a mission to turn that heartbreaking loss into a powerful force for change. So what exactly do they do? Well, Erika's Lighthouse is a nonprofit that creates and gives schools these incredible programs on depression education and suicide prevention. And here's the absolute game changer. They give them away entirely for free to any school that wants them, all thanks to their donor-funded model. And their whole approach is built for the reality of a modern school. The curriculum is free, which gets rid of that huge funding barrier right off the bat. It's developed by experts, but it's designed to be super user-friendly for teachers who are already juggling a million things. Plus, they give educators one-on-one support so they're never just left on their own. Now, this is more than just a handful of resources. It's a really well-thought-out, structured plan. Let's break down what they call their 4-pillar model. You can see it's a whole system approach. The first pillar is education, right in the classroom. The second is empowering the students themselves to lead clubs and change the school culture. The third is all about bringing families into the conversation. And the fourth is training staff and helping with policy to make the whole school a more positive place. They all work together to create this amazing safety net. And this is where it gets really powerful. Let's put this model right up against those barriers from the KFF data. The problem was inadequate funding, right? Well, this program is totally free. The problem was staff shortages. This empowers the teachers you already have. Limited access to professionals. This puts an expert-built curriculum directly into their hands. It is a direct answer to the biggest problems schools are facing. Okay, so the model sounds great on paper, but the real question is, does it actually work? Let's take a look at the kind of impact this approach is having and what it could mean for the future. Look at this number, over 4.46 million. That's how many students have been directly impacted by Erika's Lighthouse program since 2004. So this isn't some small pilot program we're talking about. This is a model that has reached millions of kids, and it's proven that it can scale. And everything they do is driven by this one core belief. It's so simple, but so powerful. This isn't just a nice goal. It's a fundamental right. It completely reframes the conversation. Good mental health isn't a bonus. It's the standard of care every single student is entitled to. And that really brings us to the final thought here. With our schools under so much pressure and millions of kids in need, models like this one show us a possible way forward. So the ultimate question for all of us is this one. How do we make sure every single student in every single school has a lifeline?